You are still on to This Morning on Light TV with Tolulapo Butime and Vivian Daniels. And also joining us in this segment is no other person than Victor Okeke, our representative of social justice. And we're talking about universal health. Just before that, he was trying to tell us what universal health is all about and why it's important for us to everybody to be able to access it.
Yeah, universal health coverage means that citizens are able to access health without financial burden on them. In simpler terms, when each of us are sick, when any one of us are sick, we would have to take money out of our pocket to pay for the health service. But not everybody can afford that. There are citizens who they've not even been able to afford their basic other needs like food and shelter. So when they are sick, who caters for them? So that's where the term universal health coverage becomes necessary. It is a commitment by governments across the world to put in financial resources to ensuring health for every citizen of their country. So it was actually an agreement between governments and some 30 years ago in Almaty. It's a city in Kazakhstan. So they came together and said that, so if we leave these citizens like this, they are going to be vulnerable. So what are we going to do? So they now set a target for themselves. We should be committing resources towards ensuring that every citizen in the country attains financial freedom from sickness whenever they are sick. So that's the essence of universal health coverage.
Okay, tell us what
Okay, I'd like to ask, based on the definition you've given, should this be part of, who takes or what takes care of health insurances that you see all over the place?
Yes. So health insurance is one of the deliverables towards achieving universal health coverage. So health insurance is just like paying ahead for yourself in case you get sick. So it's a kind of pool fund. All of us, for some of us who are in the formal sector, when we see our pay slips, a certain percentage of our pay slips is used to pay for our health insurance. So that when you get sick, you don't necessarily need to dip money out of your pocket to pay for it. Like you're paying forward for your health. Unlike what they call out-of-pocket expenditures for health. Like if you're sick, they'll ask you to go and pay for this card, pay for that before you could be given care. But when you have a health insurance, like it's a kind of buffer, a kind of backup. Just like the way we pay for insurance for every other thing, for our cars. You don't wait for your car to get accidented before you pay for the insurance. So health insurance is like giving a feed forward to our health needs. Like you don't want to get sick before you contribute. And it's a pool fund. The advantage of it is that, imagine that we are 10 here and all of us are contributing towards health insurance. Obviously, the 10 of us are not going to get sick at the same time and at every time. So that pool for resource helps to alleviate the financial shortcomings of the rest members of our group. So at the end of the year, the 10 of us might not get sick, but a few of us might get sick. So that pool fund helps to alleviate the shortcomings that they could have. Imagine if you are sick and a millionaire is demanded of you and you're unable to bring it up at the particular moment. But if you are paying for health insurance, imagine 200 million Nigerians paying for health insurance. It will be a very large lump of money. But not every Nigerian is going to get sick through the year. So health insurance helps to cover for this group of people who are unable to access health immediately. And even for you who is also contributing, if you are sick, health insurance helps you not to start running around, selling your land, borrowing from friends to pay for, because you've already paid forward for it before time.
So what are the other major components of universal health besides the NHIS health insurance?
Okay, it also calls on governments to increase funding for health, their budgetary allocation for health. You remember there was a time what they call Abuja Declaration.
Yeah, that's right.
Yeah, so governments in Africa decided that they will be contributing 30%, 15% rather, of their annual budget to health. So whatever they've allotted for that particular fiscal year, that 15% of it should be for health. Well, over the years, since that commitment was made, Nigeria has not been able to attain it. Currently, for this year's budget, which has just been the highest in recent times, 1.58 trillion, it's high enough, but it's not yet at the target. It's just 8%. So even when government keeps arguing that they're increasing money to health, but then they have a target. It was held in Abuja here, so it's called Abuja Declaration. So it is the government of Nigeria that took the lead in that commitment. So we've not been able to do that. So universal health coverage is clouded in enough resources for health. There is need for more money for health, not just more money for health, but more health for the money that is being allotted to it. So that's what the universal health coverage seeks to achieve.
Okay, now we're looking at the current government has been able to show interest by also being part of the Abuja Declaration, but moving away from that. Supposing this government is no longer in power, what happens? How do you sustain it? Because it's a major worry. Because just like you come up with so many social health insurance schemes, at the end of the day, there is a problem of continuity. What is the plan being put in place by this government to ensure that even when they are no longer in the office, successful government can be able to maintain this?
Thank you sincerely. So recently, just last year around March, the current president, Muhammadu Buhari, signed into law the amended NHIS Act. It's now called the National Health Insurance Authority Act. So Section 3 of it actually provided for compulsory health insurance. Before now, health insurance was voluntary, like it was only compulsory for those in the formal sector. But now, one of the functions of the NHIA, that's National Health Insurance Authority, is to make sure that every Nigerian has access to health insurance. So with that, every person will now be insured by health. But the value of it to your question is that even if this government should leave, any other successive government that is coming up will have to ensure that the provisions of this particular act that was signed is implemented to the letter. The three leading presidential candidates, they've made commitments. Each one of them keep talking about providing more primary health care centers, including vulnerable groups like women and children. They've also mentioned universal health coverage. So the issue, the question now is, beyond the elections, whoever wins, it is a call to duty for him to make sure that Nigerians indeed get insured compulsorily. There should be a premium paid, like for every, there should be an identity card or a kind of a way to compel to ensure, yes.
Card that you can take along with you.
Because when we talk about health, health has so much to do with, it's only healthy people that can walk. It's only healthy, because health has a correlation with the economy of the nation. If you're not healthy, you will not be thinking of coming to work. And if you're not working, you're not contributing productively to the economy, the growth of the economy. So health is so intricate that it should be a not just a political talk, it should be an action talk. The citizens should own up to it and demand that the government fulfills the provisions of the National Health Insurance Authority Act. And whichever president wins too should take it upon himself to make sure that the vulnerable group fund, which the president has already promised, but he hasn't started implementing. The vulnerable group fund actually is a fund that should be activated from the what's it called? I can't remember exactly. Yeah, it's okay. It's a fund that is going to be taken from the.
There's a pool where they're supposed to get a fund.
Yes.
Who used to cater for that particular sector.
Yes, I can't.
But why are you trying to get that? Why we're talking about the
I actually do have something to say.
Okay.
You know, so part of universal health coverage, right, towards achieving it is equitable, accessing health for all Nigerians, like you said. But my question is, how about the quality? We, as Nigerians, or all over the world, everyone being able to access quality, the word quality health. The reason why I asked this question is when you hear about, health insurances, it has happened to me personally. Like I went to a hospital, my friend registered me because I do not work in a government hospital, in a government office, right? So when my friend registered, I found out that, look, before you are attended to, it takes a whole lot of hours. You're not even there. And then the quality of drugs that you are given is no way to compare to when you have your cash. So how do we attain towards quality health care?
Okay, there are certain impediments to universal health access, which we'll discuss. But specifically to the question you asked, is more of an administrative challenge, because this health insurance, there are packages. So sometimes because the most readily affordable is the lowest card of the, so there are some health insurance companies, they have what they call diamond package, premium, gold. Yeah, so depending on how much you contribute.
Okay, so mine was, mine was not diamond. Mine was silver.
Okay.
Mine was silver.
So some of them have restrictions to what's like the package my boss is using is not the same package. So his package could afford him access to complex surgeries, but my package could just give me access to basic malaria treatment, yes, or dental care and all that.
Now, that's where the concept of universal health comes. No matter your level, what you are earning, ability to be able to access quality is very, very important.
Yes.
Now you're talking about the vulnerable being provided by the federal government.
Yeah.
With that bill being passed, will it be able to uplift the standard of quality of health that an ordinary person on the streets of Abuja or Lagos can be able to access that? Will that cover for that?
Exactly. That's the vulnerable group fund is actually a derivation of the consolidated revenue fund of the federation. So it is part of the basic healthcare provision fund. So that's what the word I was actually looking for. Yeah. So the basic healthcare provision fund is a fund that is being activated by the federal government that cater for some of these medical emergencies. So the vulnerable group fund is part of it. So the president has promised that that the federal government is going to set aside a certain percentage of the annual budget to funding it, but he didn't fulfill that promise. So we are looking forward to the time which whoever wins these coming elections should also activate the vulnerable group fund. The vulnerable group fund caters for the vulnerable, just like the word says. The pregnant women, the people on the streets, the people in the prisons, the elderly. So this fund helps to give them access, because we are talking about universal health. No one should be left behind. Yeah. So these are the issues. So if the vulnerable group fund is activated, then we'll now start tackling the inefficiencies. Some of the inefficiencies that we experience in in the general healthcare sector in Nigeria, like emergency medical services. A friend of ours recently was admitted at the hospital, the national hospital here in Abuja. So the bureaucracies around assessing care, do this, do. So we have a poor emergency healthcare system in Nigeria. So these are some of the inefficiencies that need to be catered for. Even laboratory services. Sometimes technology needs to, yes. Most of the time, if you want to get the best of results, you go to private labs. If you go to the public labs, they will tell you come after 3 days, come after 24 hours. Something that a rapid test could done. Yeah. So these are some of the issues, some of the inefficiencies that need to be tackled for us to have quality healthcare service, which is indeed universal and good for every one of us.
Before we let you go, how do we ensure that government keep to their promise? How do we ensure that successive government continue to do what is right for the masses?
Okay, we continue to do advocacy. We continue to ask citizens to own this action. We continue to ask every Nigerian to be interested in their health, because health for us, health for all, health for everyone in Nigeria is also for our own benefit. It's for the advancement of the human society. So we need to be civic active. Yes, we need to get into the talk about health. It shouldn't just be left for health practitioners alone. Myself, I'm not a medical doctor. So every one of us should own to it and demand that health should be made a priority by every government that comes in place.
Okay, you know why I'm smiling? I was actually thinking of something yesterday, or rather it followed me into the year. The part of knowing whether or not your health should be a part of your goal each year. Most of Nigerians, I mean most of us, Tolu, definitely I know you didn't write that carefully as part of your goal in 2023. And it's not just him and I. We don't make conscious effort to attend to our health. And I think really, it should be something, advocacy, awareness that you're talking about should really help every Nigerian to take care of their health, wherever they are.
I totally agree with you.
Thank you so much, Victor Okeke, for joining us this morning. Hopefully another time we can have you as we continue the fight against having universal health for all, because it's important for us to be able to access that.